Okay, I believe that we are recording. I'm sorry, I was just saying that I'm Joanne. My background is in patient advocacy in the States on a national level. I built a patient registry for a large disease group on the same infrastructure, and then was intrigued by its capabilities and came to work for the organization, which at that time was Patient Crossroads, focused solely on patient registries. That company was acquired by Invitae, this company that owns the infrastructure now and that I work for. And we continue to offer both full fare private patient registries that are sort of high dollar and difficult to maintain, but we also offer this no cost to advocacy, templatized, scalable solution for smaller groups or groups without large budgets to put up a registry quickly, easily, at no cost, and gather data. It's not everything you would get in a full fare registry, but it's lots and lots of what you would get. So Annalisa and I have been working on this page. This is the template. All of our pages look similar to this in terms of design, with a circle, image, and then the content is customizable to your group. So has everybody had a chance to see this already?
Yes.
Okay. So Annalisa has submitted most of this information to us, and we've implemented it. This is a video here that's able to be turned off or turned on your site, whichever way you choose to move forward with it. It just helps orient families to why data collection is important, and it's just a quick look at patient-reported outcomes and why we use them. So in terms of our partnership with our advocacy partners, what we try to provide is Invitae's investment in this program is the infrastructure and the survey expertise and the management of the software. But what we really depend on the individual groups for is the marketing and the spreading the word of the opportunity to the families in your network, so that the data collection process is really more the heavy lift of the advocacy groups than it is on Invitae. We're providing it to you, but you have the boots on the ground, connection to the families, and can encourage them to join the effort. So this is live. We can edit this and make changes as we go along. It has some build outs that are possible for you. We can include any number of tabs here if you have something specific you want. We explain what this infrastructure does. We include the contact information, and we list our promises to patients, how we're safeguarding their data, etc. I guess it bears explaining that the system is designed to meet FSMA requirements, which are the strictest data protection requirements that are mandated by the National Institutes of Health. We do provide registries for the NIH, and so our system as a whole meets all of the standards for protection. So that's a very costly and time-consuming and detailed set of safety measures that we comply with. And in addition, anybody that touches the registry data has been trained in human subject research protocols and so forth. So we are a full, the safety of the patient is really foremost in our mind. So this is just the setup of the front page, and we have lots of ways that we can go with that, and ways we can build that out if you like, and linking out to your Facebook pages or linking out to your sites for your disease group, etc. This is a look at the account registration page that a family would complete when they decide they want to join. So we ask for all of these, and these account details are maintained in the site, but they are not shared with you, and they're not shared with any researchers that you are including. These are all held in you know, securely by our group, necessary to confirm the account, et cetera, but not shared out with any row level data that we produce or anything like that. Please stop me you know, if you have questions as I'm rambling on, just let me know. There is a detailed, you know, terms and conditions and privacy policy that folks can link out to and read, and they do have to check this box that they agree to those terms. Once they complete this page, there is a second set of information that they provide on the patient's information. So this might be the parent's information here on the first page. This is the account holder. I'm just going to go through it really quickly so just so you can see what the next screen.
He didn't answer his phone.
Hi?
He didn't answer his phone.
Oh.
This page is creating an account. The following page sets the consent and sharing levels that the family is interested in participating in. Sorry, I have to add your diagnosis here. It's missing from the list. But this will be a short drop down menu. If there is only one, if we're collecting on Hist1h1e only, that's the only thing that will appear in this top box. And then you'll see this is going to be the child or the patient's information here. Also never shared. Some things are shared, sorry, gender, age, not date of birth, gender, age, ethnicity, state or province level, location, never the zip code, never anything down to that level. But those few there's like 8 demographics that can be included that are not considered personal health information that are very useful if you're analyzing survey data, right? And then these are the contact and sharing preferences. So families are deciding if they want to share their email address with you as a group. And if they do, we provide that to you in a list form separate from their data. So you will see all of the data that you're exporting. That would be a separate list from the emails that you receive. That's for the patient's privacy. Although we all understand in ultra rare diseases, you likely may already know which data belongs to each patient. We see that a lot, and that, you know, is inherent in a small population disease group. So 4 individual consent questions, yes or no to everyone, including do they want to hear back from us if there are any clinical trials or research information that's relative to them. Then we know we have consent to reach back out. If you should align with, let's say, a research company or a pharma company that is interested in recruiting for a trial, we know which of your families want to be contacted about that and who does not. So that's the end of that registration process. What a family sees, sorry, go back here. One of the opportunities to you as a group is to create a condition-specific survey that we build for you and post to your families without charge. And we'll put one up for you every year. If you have the time and energy and inclination to develop one a year, we would host one for you every year. Most people create one survey. If it's between 30 and 40 questions, that we don't charge for that. Some people plan that out in a more longitudinal way, where this year they want to collect data on the road to diagnosis. Next year they want to collect information on access to care, you know, and they'll segment it out that way and reach back out to their community over time that way. This is what a family will see when they have registered an account and they're interested in participating. This is a dashboard or their profile page, and it's going to call them by name up here, and it's going to give them a chance to update those sharing consent or their contact information if they wish. And you have to pardon mine because I'm registered for a whole bunch of different diseases, but they'll see in this box here all the surveys that they have access to and they can complete. And there are 4 core surveys that, and I'll send you copies of those if you're interested, that we host on every registry. And those are short surveys on diagnosis, family history, medical care, and a more comprehensive general health questionnaire that is really a systems overview, you know, looking at the body systems, similar to what you'd fill out in a health history. We serve those to every group. However, if you develop your own survey, that one would come first. And as a family registers, as they hit the button to submit their registration, they're taken directly into your own survey. We know that the first survey gets the most completion, so we want that to be the survey that you're most interested in. So there are opportunities for families to quickly enter other affected individuals in their family by using this family member function here. They don't have to go through the full registration process again. They can add a second child if there is one quickly and easily, and they can toggle between those 2 accounts to add survey information. They can input healthcare provider information and add them to a list of providers that might be useful to you as you are trying to locate the leaders in the field that you're, I just typed in the name Johnson, but in your case, you know, there'll be specific clinicians that patients are saying that they could enter or they could add to the list if they don't see their researchers here, or physicians here, and we can provide those listings to you. That becomes useful to some groups, right?
Can I request that people mute their microphones if they're not speaking? It's in the top right.
The other option you can take advantage of, or you can disable on your account, is the uploading of test results, or medical records of any kind, really. I'll just say that this is mostly useful for genetic testing results, whether they're done at Invitae or any other lab. We have a companion program to this PIN registry program that allows, if a family uploads their genetic test results, we have ClinGen curators that can access those test results, can translate those into a de-identified survey format. They submit that information along with some of the phenotypic data that's collected in your surveys to ClinVar, the national registry supported by the NIH. What happens with that is NIH gets information, and we've published quite a few studies, if you're interested in those, that show that this program specifically is contributing lots of novel genes to ClinVar, and that's important too, where genetics is going, you know, and how we're identifying variants of significance in disease groups going forward. But what it does for your group is it provides you the access to the downloadable row level data from those curated reports, but they're de-identified. So you don't have to support the curation of those. You aren't exposed, and neither is the patient, to any identifiers, but you get to see the phenotypic and the genotypic information in one place. And that can be useful for your own research that you're doing. So it's an extension of the program. It's free of charge. We add it to your, there's a survey that patients review and consent if they want to share their genetic data, and they upload it and we do the rest, and then you are provided a download of that data if you wish. So this is what the patient sees. Here's a unique feature of this patient registry compared to other, you know, there's 3 or 4 other sort of low cost or no cost registries out there in the field that provide some similar service. But one thing that the PIN program does is provide patients a look at where their survey answers compare to the answers of all the other families that took the survey. And that we've heard from patients, you know, that this is useful when you are isolated, alone, dealing with a rare disease and feeling isolated. A look at where your answers to questions on surveys line up compared to other families. It isn't social networking by any means, but it is a way to orient yourself to your, I'm trying to pull one up here so you can see. Oh, I don't have any data. I'm not a real patient, I'm sorry, but what you would see here if you were a patient is if we asked what type of doctor provided your initial diagnosis, you would see all of the answers and where, and a little bright spot where your answer was among those answers. It's maybe a small thing, but it can be super valuable for the families. And the other thing is that this map would begin to be populated as families join the network, so you could see not down to the zip code, but more generalized locating information. You can't zero in on a patient's address on this map, but you can see everybody that's in the program, and you can filter this by males or females if you want. You can filter the survey answers too by people in your age group, people in your child's age group, and what their experiences are. And so it's just a service to the patient.
I'm going to chime in here and say that that is critical for our particular group, because one of the most common questions I get are there anybody else living near me with this syndrome?
Yeah.
So that's fabulous. Thank you for offering that.
I'll tell you that we stop short of connecting patients. We tried a matchmaking thing in the past, and we really found that because of the other social network and advocacy related matchmaking services patient to patient, we really wanted to be clear that this is data collection. We can orient you to, who's in your area, but we stop short of actually matching patient to patient. So, but still useful.
You're showing the United States map here. I'm assuming that this is available globally.
Yeah. So the site itself is GDPR compliant, and we can collect data from all over the world, and most of our programs do. I'll just share that in another rare disease, we have a registry for Canavan disease. It's another ultra rare disease started by one mother. She ran a state, an Illinois advocacy group for families with Canavan disease. She started the registry. She did a few simple marketing activities, such as buying Facebook AdWords and to market it around the world. And quite quickly, within a year, she had developed the largest body of data on Canavan disease in the world. Just the patients, the families are hungry to connect. They want to contribute. When there's very little you can do, this is an action they can take in their own home, that may lead to innovation or to, the research that's needed in the community. So I like to point to her as she was a one-woman show. We just built this simple page like Annalisa and I just did, and it really, and now there's pharma interest in her disease, and there are some associated pharma deals on that pin. So it may help to point out that we do try to assist you where opportunities exist to partner with researchers, whether they're academic or they're industry stakeholders. Sometimes we extend these free platforms to include data collection by a particular pharma company. We might host a survey, they might pay us to host that survey, and they might contribute money to your marketing efforts as well if you wanted their involvement. Some of these studies are IRB covered and some are not, and some of our advocacy developed surveys are covered by IRBs and some are not. We can host informed consents, but we don't have to host informed consents. But in the case of pharma-driven surveys, we present the opportunity to patients, and of course, everything we do is patients opt in or out. It is, we're firm believers in, we don't sell this data, we don't rent this data, we don't expose anybody's identifiers or release any contact information without a patient-specific and clear consent. So I'm going to flip over.
Joanne, just one comment there. This is Michelle, I'm a genetic counselor. So everything is transparent that we do when it comes to those issues. Is that right?
That's correct. Yeah. And most often, you know, when sometimes advocacy groups feel that they might be losing some control if they put this pin up, and then we might be hearing from researchers, commercial or otherwise, and that you would be left out of that. Most often, any pharma related work we do is brought to us by the advocacy group because, well, for one, drug developers have learned that patient advocacy groups are vital to whatever development work they're doing. And usually they reach to you before they would ever know about or reach to us. So it's a collaborative effort across the board. There is no, when we first were purchased, the registry software acquired by Invitae, there were a lot of questions about what was our business model, why were we doing this, you know, how can we offer this at no cost to groups? And I really, you know, after 3 years now being under the umbrella of Invitae, I have to tell you that there is no true business model for these pins except to serve the community and to do the research and create the deals that might be useful to the community. That really is, we can't devote lots of time and effort to the registry. That's part needs to be clearly understood, that the work really falls on your shoulders to make it what it can be, but we can provide the infrastructure, the survey model, the data back to you, you know, for your use. You may publish on that as widely as you have the ability to do. And we've seen a lot of great things happen for communities. So this, I'm just switched over here. These are public pages, and this is an automatically generated infograph. And this one's on a specific condition that we've been collecting on for some time. But this will be created for you as soon as there are 10 families in the registry. We won't publish unless there's 10 or more individuals in the registry. But it's a nice tool that's, you don't have to spend a lot of time creating graphs and charts. It picks up some high level, important data points from the registry that you can use in, you know, the work that you do. So I just wanted to show you what this looks like. These fields are not customizable. This is a standard template. So, and then your logo would be down here at the bottom.
Joanne, at the top, when you had the presenting top right, getting diagnosed, initial symptoms, what's that based upon? Is that, do you have to have more than 80% or what's that? Because that's quite an important thing that people will look at, I would have thought.
So this is from a question on our diagnosis survey. It's a short survey. I'll send you out paper copy or PDF copies of those surveys so you can see what we collect as a rule. But it is a multi-select question that lists, you know, a number of symptoms, right? And what were, so the patient selects, and they're not scaled. So it's a checklist. So these are the highest, the most frequently selected 3 symptoms from that checklist in this disease group. Okay. Am I explaining that clear enough?
Yeah, no. I'm just trying to think about how it would relate to, so in San Filippo, I'm surprised that those are the highest 3. I would have thought there would have been, so I'm just interested to see how it was chosen. And whether it was
on your own survey, that data is available to you in a export that's row level export, right? So any type of analysis you wish to do is possible to do. So you could see, you can break this down on your own by age. You know, this is going to be related to the age onset, right? So you'll be able to really drill down into some pretty important insights on the disease just by, you know, if the community is taking the survey, there's lots of data available for, in this group specifically, this particular group, something that was discovered in their registry that had not been known in the treating community was how often patients required myringotomy tubes placed in the ears in this set of patients. And it was discovered in the survey that all the parents were reporting that their child needed tubes, but clinicians in the field were not aware to watch for the need for it, right? And so it was a piece of data developed or discovered in the PIN that the advocacy group was able to educate the key opinion, leaders in their field on what to look for in this community. So that's just a simple example of how you don't know what you're going to discover until you discover it, right? You have to ask the question to find meaning, for your community.
And I think that's a little bit about the disconnect here, or it could be about the disconnect, because what the parents might rate the highest, maybe the clinicians wouldn't rate the highest, right?
Exactly.
So that's a little bit of a difference there.
And Michelle, that points to the importance of the patient-reported information as a, at foundational level, right? What is meaningful change to a parent may not seem a meaningful change to a researcher, right? If a parent gets one more peaceful hour in a day due to some intervention or some treatment or whatever, this is a meaningful change to a parent that might not be on the radar of any, clinician. So being able to, gather that information and report on it has been meaningful to groups that really need to push for change in policy and change in process of treatment, that matters to them and may not be obvious.
Yeah, you're really bridging a gap there potentially. And that's what's so fabulous about this, I think.
But I think you're right that it'd be really important to know the ages.
Yes. Yeah.
Because I think that would make it even more powerful.
Right. Absolutely.
Joanne, would you mind discussing, and maybe I'm jumping ahead, what the researchers aspect, or what participation do the researchers and doctors have in this?
Sure. So you as advocates and any interested non-commercial individual has access to what we call our data portal. This isn't very fancy. It's just the portal for researchers to take a look at row level data. We believe strongly that data openly shared will lead to treatments and cures faster. And so as long as it's not a commercial entity trying to capitalize on your data collection, we approve most applicants that want to see row level data. And when I'll send you the link to this site, Annalisa has it already, but when an individual is registered on this site and they've chosen the disease groups that they're interested in, they can export the row level data. I forget what I'm registered for here. I am looking at, this is not a genetic disorder, but this is the registry on circadian sleep disorders. I have all of the 4 core surveys available to me here, and you will see those in your disease group too. So the diagnosis survey, general health, family history, whatever. And I can choose, here I'm looking at all their registrants around the world in their group. And then I can see, I can see some quick charts and graphs of the data collected, sorry. And I can, oh heavens, excuse me. I can look at charts and graphs, and I can export the row level data too. You as a group, or any researcher that you are driving to this portal, has the opportunity to download the entire survey, every question, or let's say you're interested in just an aspect right now. Kate, you want to look at the symptoms that led to diagnosis. You can just select the questions of interest, and these are the demographic fields I was explaining are available to you. So you can select or deselect any number of demographics and survey questions. Your own survey will be available to you in this manner as well. And you can choose whether to see the most recent survey or all of the surveys completed by the individual, or any survey completed, any survey submitted, whether it is completed or incomplete. So just a variety of ways to look at the data. The other thing I'll say about that is if you are going to develop your own survey, you can develop a survey that is longitudinal in nature. If you decided you want to see progress and trajectory of things, you can organize your survey that way, and we can help you design a survey that each survey session with us is date stamped. So you can, and it has, each patient has its own ID. So you can effectively, if you are asking right questions, monitor somebody's journey in a date stamped way. So you can export those and analyze data that way if your survey is collecting like that. And we can implement a survey so it's repeatable, or we can implement a survey so it is a one-shot survey that cannot be retaken. So I'll pause for questions if you have any, either about the site itself or how you access data, or who else has access to data.
I'm going to jump in and say, this is Annalisa. I'm definitely a call to action for anybody who's on the call and anybody listening to this recording, that I'm going to need help with different surveys and anything that you feel needs to be added to the site that I didn't add already. As Joanne mentioned, we were working behind the scenes based on the information some of you provided, but if anybody else would like to add anything additionally, I'm happy and more than open to do that.
Annalisa, this is Michelle. I just had a question about how you're capturing people that might know the syndrome under different gene names or under different other names. How are you capturing those individuals?
I don't know. Why are you talking about?
Only because I mentioned that because
misdiagnosed?
maybe how we have a way of capturing different gene names that are the same gene, and the syndrome names are the same. We have a way of capturing that on the pin.
Yeah, we can do that one of two ways, Michelle, and I prefer one method, and I'll tell you why. So I would prefer to collect on the true name here, or the name of the registry on the registration page, and not provide a list, but provide an explanation on the page. Register here if you, and we can change this format here to include a long list of other possible names this might be called, and then have the one listed on the registration field. And the reason for that is those infographics, because if we call it 5 different things, the system will want to create 5 different infographics. So it's better to define the list to the families and give one option on the registration page, if that makes sense.
Yeah. Okay.
So
thank you.
I would ask the doctors, because they would know the other acronyms or other names that this might have been associated with previously, and maybe moving forward if the name is called something else. I know Raman syndrome is what it's called previously, and people still sometimes call it that when they contact me.
Okay. So that's a good example of, one of the things that, could be there. Great. Thanks.
If there is one,
the different gene names as well. So I think you're absolutely right. On that landing page, you've got to have the synonyms so that people can realize they're on the right page if they've been given a different name. One of the things that I think I was pleased to hear you saying, Joanne, and I think is really, really important from this, is the longitudinal data and being able to link that to individuals.
Yeah.
And so is that easy enough to pull out, because in terms of the GDPR, are you releasing patient names to be able to link up the various time spots to that name, or is everyone given an anonymized code that you're linking that longitudinal data to?
The second way. Each patient account has an ID. So you'll relate them and sort them in your export. I don't have one up to show you, but it'll be an Excel export, a CSV file. And everybody has a patient identifier. Every survey session has a date and time stamp. And then the survey data flows out on the sheet to the right. So you can sort those by patient ID, and you can see, you can chronicle, their answers through time. Yeah.
You'll be given the age of the person.
Yes.
And so how does that tally with the genetic reports that are uploaded? Because presumably they're completely identifiable.
They are disconnected. So you have to think of those as separate. You would have to do after export merging of that data, but the patient ID is the same. So you can relate the survey answers that you're collecting longitudinally and
Yes.
the genetic data, but you have to merge those after in Excel or in REDCap or some other, analytics software.
But as a researcher, you wouldn't see the patient name on those reports.
No. And that's the beauty of that ClinVar, ClinGen partnership, is that they are doing the qualified researchers are doing the de-identification and the translating of those. You've all seen genetic reports. They come in a variety of shapes and sizes, right? So a trained genetic counselor is taking the information from the report. She's putting it into a survey format so that we can keep it de-identified, report it back to you, report it to ClinVar, all de-identified. So the only way you can match up the two is by comparing the IDs, the patient ID.
And then how freely accessible is this? Who gatekeeps? I know you said that you want as many people as possible to be able to access the data, which I think is important, but is there only gatekeeping? And if there is some gatekeeping, who's doing that?
In terms of who can enter their data?
Who is going to be, yes, accessing and then analyzing the data?
So we have a small team of developers and project managers such as myself on the Invitae side. And that's a well-structured, team of professionals, like I said, all trained in patient privacy and protection, and also in internet privacy and security, right? And this is stored on the cloud, but in a super secure method. As far as patients entering the site and entering data, we have mechanisms in place to keep bots from entering data and to keep spam accounts from being created. Those are mechanized, and we do review data on that level. But we do represent the data as is with all faults, right? Because patients, this is accessible on the internet. Anybody could find it. Anybody could enter, and we are not monitoring that piece, if that makes sense. You're going to know when you see your data, especially in a community the size of yours, what's valid. But we do not see, once in a while, we'll see a site get on somebody's bot, system, but that's mechanized, and we know how to delete those files and protect the site and that kind of thing. But an individual family reporting information that isn't quite accurate, we can't and don't solve for that. But again, it's not that much of an issue. I've rarely seen an issue. We do confirm, though. Let's say if we looked at your infograph and we saw a 90-year-old patient, patient ages 3 to 90, we would know that a parent reported mistyped a date of birth. And so then we could reach out via their, I could reach out via their profile page and say, I think we have a date problem here. Can you confirm, the date of birth? So we do those types of corrections where they're obvious. Does that answer your question?
Yes.
I'd like to ask a question to Dr. Tatton-Brown.
Yes.
Hi, this is Paul Tannenholtz. I've been corresponding with one of Rebecca's doctors, a Dr. Raylan Forsyth at Johns Hopkins in Baltimore, Maryland. And she sent me a message 2 months ago saying, I just wanted to let you know that I am waiting to hear back from Dr. Tatton-Brown regarding logistics of uploading information into their registry. I look forward to meeting her. So did that ever happen? Do you have Rebecca's information already in there, or do I need to add it?
No, thank you for asking the question. So I've for a long time been talking about the need for a registry like this, and have been having conversations with many people, and that's why I'm on this call today. Nothing is yet set up. So I think it really is what the best solution is for the family group. But yeah, so there isn't a competitive registry, and which registry they want to use, because I
Oh, I missed the last 30 seconds. The audio cut out. If you could repeat it, I'm sorry.
it's my internet. Can you hear me? Is that all right?
Kate,
Now I can.
Oh, I was just saying that's.
You might want to turn your video off. It might help with the audio.
I don't know whether it's my audio. Can you hear me again?
You keep breaking up.
Now-
So if you turn off your screen, turn off the video part, maybe it'll help with the audio.
Okay, is that better?
Yeah, it might be better.
Yeah. So I was just saying that how important I think it was to have a registry, and that I've been looking at different options because I think it's so important to be able to gather the longitudinal data, because that really informs the management that we suggest, the surveillance that we suggest. And so I have certainly been looking at different options, but that's why I'm on this call today, to see what this registry is like, which I think looks fantastic actually. And I think the fact that it's free as well is an enormous boon for it. So the simple answer to your question is that no, it isn't that your daughter's data has been uploaded to lots of different registries. It's trying to find the best registry that works the best for the families.
Okay.
I'll just chime in to say that we do not have the clinician entered mechanism for this registry. This is patient entered only. You know, we do have some models in some of our private work where, you know, we're collecting from both physicians or clinicians and from patients, but not in this model. This is strictly advocacy led and patient offered.
And this is Annalisa. I met Michelle at UCLA when I did a talk. Some of you might remember I talked a little bit about that. And one of the things that I was excited about was that because of the groups, like the Facebook groups, for example, a lot of these questions were coming up about different symptoms and who lives where. And so this was a nice solution to consolidate this information. And while Joanne says, yes, we don't get the doctor end of it, it doesn't mean that the doctors won't get this information, and Dr. Tattenbrown and Dr. Burkhart, Dr. Wexberg cannot contribute in their own way as well once they get this information. So it's a collaborative effort on everybody's parts is how I see it. And it's free.
I thought while you're mulling these things over, I would just show you what a survey looks like to the user. I just opened the diagnosis survey if you have access to a screen, and this is how the patient family sees the survey laid out with drop-down boxes and so forth. I will mention that we are very mobile ready, and so more than 50% of our families use take their surveys from their phone, and it's well designed to reformat for smartphone. So that's useful, especially when families are busy. Lots of, you know, these folks are sitting in therapy with kids and can do this, you know, in a doctor's office even as they're waiting. But this is a look from a desktop. And these are some of those questions. Which of the following symptoms led to the initial medical evaluation? Just a long checklist that ends up informing that infographic.
On that note, I had some feedback from a parent when I first gave them the site that you created, Joanne, and she did say that it wasn't mobile friendly right yet. Like some of the pictures were cutting out. So just an FYI.
Okay. Not something that we hear too often, and it, you know, may depend on, we just have to look into the individual case.
Okay.
Try it yourself. Look at it, use your smartphone and
Joanne,
yep.
Joanne, sorry, I'm going to have to go because I have another meeting to run to that starts at 5. But could I just ask you, you said at the beginning that the survey can be completely tailored. So we don't have to follow the questions that you've got listed here. Or are there some questions that Invitae definitely want?
So we host these surveys, 4 surveys will be on your PIN automatically as part of the contract we make or the agreement we make. If you compose and implement your own survey, that one comes first, and you will often see that families don't have time or the inclination to do all of the surveys on their page. Most often they do the first survey that they see, which hopefully is disease specific for you. But it bears looking at these other surveys in advance, and I'll send out a copy Annalisa can distribute, that you see what we are trying to collect and what we're encouraging collection of these same survey answers across all of the diseases we collect on, because in the future we are hoping that there's alignment. There are discoveries to be made about the journey of your kids and the journey of kids with other genetic disorders. So we serve them for a reason, but nothing is required to be taken. But if you're making your own survey and you see that we're collecting these answers, you know, it might inform what you want to try to collect.
Okay, thank you.
Mm-hmm. So I'll send out some surveys. I'll also send back to you, Annalisa, the agreement we make with advocacy groups. It's really just a handshake agreement. We agree to do these things, you agree to do these things, and here's where you'll access your data. And if there are follow-up questions you have about the details of how we work or examples from other sites or whatever, I'm happy, from other groups, I mean, I'm happy to provide you some what are those called? Referral, you know, some people that you might want to talk to that are using this in their disease space and that kind of thing. So I'll, whatever you need to evaluate, just let me know.
Thank you.
Thank you, Dr. Tattenbrown, for coming. I appreciate your time.
Thank you for inviting me. Sorry that I have to dive out, but I found that really interesting and very exciting. Thank you very much.
Great, good meeting you.
Yeah.
Any other, Annalise, anything on your list I didn't touch on that you'd like to share?
Maybe the segment on coordinators. And by the way, if there's pictures, you guys want to add more pictures, there's, you know, different ways to make it more visually interesting. You let me know too as part of the feedback from this call. I'm happy to share that with Joanne. Or you can contact Joanne. Would you prefer that they go through me with questions, or do you want them to contact you directly? What would you prefer, Joanne?
You know, for the time being, I'm happy to take questions from the field, but ongoing, we try to have one representative for each PIN, just so we can manage, you know, the
I'm gonna listen to this. I'll call you back.
Okay. So I can definitely be that person to help consolidate. But if any of you are comfortable sharing your ideas with Joanne, sounds like she's open to doing that as well. So.
Hi guys, just a quick question on our side here. First of all, thank you ever so much for everyone that's done a lot of work in the background. We're still very much on the sidelines, but very interested in all the developments that have popped up on the Facebook chats and stuff like that. Can I just ask, in regards to the previous participant, they said about their consultant asking for, you know, what surveys are going to be entered and all the rest of it. And obviously, this is what we're trying to set up now. So, am I to believe that this Invitae is a short list, or this is what we're going with at the moment?
I'd love for everybody to go with this PIN registry. That's kind of why we're here today, to encourage those to sign up with this. That's the goal. Okay.
It feels like somebody, probably yourself, has done an absolute load of work in this, and it's great that we will have the option of saying something, but I really think if you guys have done so much work in the background, we should definitely bow to the superiority of the knowledge. But at the same time, if Joanne has anything, not she'd like to say about any competitors, but if we know of anyone else that's in the shortlist, we should probably know about them and find out if there's anything that they could possibly add. But at the same time, I think the fact that everyone keeps asking for these registries, I think we should definitely go with sooner rather than later as well. So, you know, I'm sure we can always look at the pros and cons of each side and work out which is the easiest to set up and the quickest to set up, because I think it's in everyone's best interest that these registries are set up as quick as possible. But obviously, from a family's side of things, I think cost is definitely one of those things that may be effective. How are we addressing cost?
So let me jump in real quick before I'm out of time. I do have a hard stop at 9. To say that there are several leaders in this space, and I am happy to provide those names to Annalisa. We have, you know, she has put in a significant amount of work, but you should always do, this isn't a sales call, and we don't make, money is not driving our pitch to you today. So I'm happy to tell you who those folks are, and there are some differences in all of the different programs. I'll just tell you that I think ours provides you the most freedom and access compared to those other lower cost programs. And I'm showing you a different site here if you can see it. This is the Connect MPS registry on the same platform, all the same agreements we have in place. But I wanted to point out that 24 worldwide advocacy groups have signed on to this one registry to make it the one place where their patients contribute their data, because fracturing of data is one of the most significant problems in these kinds of, where everybody now knows the importance of patient-related outcomes data, right? But if one researcher over here has a small database and one researcher over there has a small database, it's difficult to, you know, you're not comparing apples to apples, and patients are asked, families are burdened by a request to fill out these surveys, and then a request to fill out these surveys, and then a request by a third organization. So my, you know, advice to your community is do your research first, choose the one that best suits your needs, and then try to convince as many of the families working, you know, around the globe to join that initiative, because that will be the most bang for your buck and, you know, create the most power.
I'd like to make a comment too. I am not in sales. I'm a genetic counselor. I'm not in sales at Invitae, but I have to say, in my experience with rare diseases, when particularly, and I'm not casting aspersions, but there are researchers at academic institutions that have held databases private. They don't share with ClinVar. Like this data is shared. There's no access to the data. The patients cannot get their genetic testing reports. I know that's mostly been done in the past. It's not that prevalent right now, but it does still happen, and it really does not help anybody in the rare disease community the way it does with shared data.
And I will jump in to say that Tim and Leslie, I have researched this in the background for folks, and Invitae has offered to do this at no cost. Most of these other places charge.
Yeah.
So that's something to consider as well.
That is true. Most others are low cost compared to, you know, are no cost. I don't know if you've looked at Sanford Cords or looked at Genetic Alliance, but those two groups offer something similar, and they do charge, and they do not allow you the same free access to data that this firm, or the opportunity to develop your surveys, you know, to your specifications and so forth. So.
Well, thank you very much for answering those questions, and I appreciate that, because, as I say, we are definitely on the sidelines, but we appreciate anybody who's done all the groundwork and started building the foundations for this. So thank you, whoever you are on the pictures, which I can't see.
I'll also say, I have to say thank you to Annalisa, because this is not a program we market widely at this time. We used to offer it to all comers. Genetic diseases are not genetic diseases, and we have a really, because of the focus of Invitae and other things, we just don't go out and try to recruit for this free program. And Annalisa has really pulled me through this process, getting the page up and ready for you to review. And so she deserves a lot of credit for her work to this point.
Thanks, Joanne.
Absolutely.
Thank you very much. I'm
Thank
happy
you.
to do it, and I'm happy to do it for our kids. That's why I'm here. I just want to take the time while on the call to say this has never been about me. It's always been about the children and my child having this syndrome. I want to find out just as much information as you all do, and that is my drive, is to help these kids as much as we can. So I think this will help for sure.
If there is nothing else, I'll follow up with some materials for you to review offline and be happy to take your questions. And just really, appreciate your time and attention and your great questions today.
Thank you so much, everyone.
Thank you, everyone. This is very informative. I appreciate it.
Thank you. Bye-bye.
Thanks.
Bye-bye.
Bye.